Tonight, while you sleep, the position your body is in could be silently cutting off blood flow to your brain. I am not exaggerating. I have seen it happen. I have held the charts of patients who went to bed feeling perfectly fine and woke up unable to move the left side of their body. And when we traced back to what went wrong, it wasn't a missed medication. It wasn't a bad diet. It was the way they were sleeping. I'm Dr. James Hargrove. After 30 years in internal medicine and geriatric health, I can tell you that sleeping position is one of the most overlooked risk factors in cardiovascular medicine. A study from the National Institute on Aging found that certain sleeping positions can increase your risk of stroke, heart attack, and chronic pain by more than 60%. And most seniors are doing it every single night without knowing. Here is what keeps me up at night as a doctor. I have stood in hospital rooms at 4 in the morning watching a monitor flatline, knowing that the man in that bed had gone to sleep 8 hours earlier feeling completely normal. His wife kissed him goodnight. He adjusted his pillow. He closed his eyes. And somewhere between midnight and dawn, the way his neck was twisted on that pillow compressed an artery that feeds his brain. By the time the ambulance arrived, half his brain was already damaged. That is not a rare case. That is a pattern I have seen repeated dozens of times. Tonight I am going to walk you through the 4 sleeping positions that are quietly destroying your health after 60. I will explain exactly what each one does to your arteries, your spine, your heart, and your brain, with the kind of detail your doctor probably never had time to give you. And then I will show you the 4 positions that can actually protect you, reduce your stroke risk, and help you wake up feeling years younger. Stay with me because what I reveal about position number 1 will change how you think about sleep forever. Let me start with the one that surprises my patients the most: sleeping on your stomach. I call this the artery kink. It feels comfortable. Many of my patients tell me it is the only way they can fall asleep. But from a vascular standpoint, it is one of the most dangerous things you can do to your body after 60. Let me tell you about Harold, 72 years old, retired carpenter from Ohio. Harold had slept face down his entire life. Arms tucked under the pillow, head turned to one side. He told me it felt like his back finally relaxed. But what Harold did not realize was that every single night, he was twisting his cervical vertebrae into a position that was compressing his vertebral arteries. These are the arteries that run through small openings in the bones of your neck directly to your brainstem, the part of your brain that controls your heartbeat, your breathing, and your consciousness. Here is what happens inside your body when you sleep face down. When you turn your head to one side for hours, your neck muscles twist unnaturally. The vertebral arteries, which pass through small channels in your cervical spine called the transverse foramina, get kinked. Imagine stepping on a garden hose. The water still flows, but at a fraction of its normal volume. That is exactly what is happening to the blood supply feeding your brain. For a young person with elastic, flexible arteries, this compression is temporary and harmless. But after 60, when your arteries have stiffened from decades of use, when there may be plaque buildup narrowing the passages even further, that kink becomes genuinely dangerous. A study published in the Journal of Manipulative and Physiological Therapeutics found that sustained neck rotation during sleep significantly reduces vertebral artery blood flow. In seniors with existing atherosclerosis, this reduction can trigger what neurologists call a watershed stroke, a stroke caused not by a clot, but by insufficient blood reaching vulnerable areas of the brain. But the damage does not stop at your arteries. Pressing your chest into the mattress compresses your diaphragm, the large muscle that controls your breathing. It limits how deeply your lungs can expand, forcing shallow breathing throughout the entire night. For someone over 60, this means less oxygen reaching your heart and brain. Your blood pressure rises, your heart rate increases, your body is working harder to breathe when it should be resting, and you wake up exhausted, foggy, with a stiff neck and tingling in your hands, never connecting it to how you slept. The American Chiropractic Association has warned that stomach sleeping increases the risk of cervical misalignment, a condition that causes long-term balance and coordination problems, especially dangerous for older adults who are already at risk of falls. Harold came to me after waking up one morning with numbness in his right hand that lasted 3 hours. His MRI showed early signs of cerebrovascular insufficiency. His sleeping position had been starving his brain of oxygen for years. We changed his position that week. Within a month, His morning headaches disappeared and the numbness never came back. Now let me tell you about the second dangerous position, the fetal curl. Knees pulled up to your chest, arms tucked in, body wrapped into a tight ball. It feels safe, it feels protective, but for your heart and lungs it is slowly suffocating you. Let me tell you about Eleanor, 68 years old, grandmother from Michigan. Eleanor had curled into a tight ball every night for as long as she could remember. She said it felt like she was cradling herself to sleep, but she kept waking up short of breath, with back stiffness that took hours to fade, and a deep fatigue that no amount of coffee could fix. Her family thought it was just aging. It was not. Here is what her doctor found. When your knees are pulled tight against your chest, your diaphragm gets compressed between your folded body and the mattress. Your lung capacity drops by up to 30%. Now think about what that means over 8 hours. Your body is breathing at 70% capacity all night long. Your blood oxygen level drops. Your heart has to pump harder to compensate. For a young person, this is barely noticeable. But after 60, when your lung elasticity has already declined by 25 to 40% naturally, that additional 30% reduction means your blood oxygen can drop into a range that puts real, measurable stress on your heart. A study from the American Journal of Respiratory and Critical Care Medicine showed that chronically reduced lung expansion during sleep is associated with elevated nighttime blood pressure, increased cardiac workload, and higher rates of morning fatigue in seniors. Your heart is doing overtime every single night while you think you are resting. Eleanor's tight curl was essentially putting her heart into a stress test from midnight to dawn. But there is more. Curling tightly for hours puts your spine into an unnatural C shape, shortening the muscles and ligaments that support your posture. Over months and years, this accelerates spinal curvature, making you more stooped, less stable, and significantly more prone to falls. A spine specialist I work with, Dr. Leonard Hayes, calls it teaching your body to shrink. Eleanor's posture had visibly deteriorated over 5 years. Her balance scores had dropped dramatically. Her risk of a hip fracture had doubled, all connected to how she slept. The third position might surprise you because doctors used to recommend it, sleeping flat on your back with no support, the soldier position. Straight spine, arms at your sides, head barely on a pillow. For decades, this was considered ideal. But for seniors, especially those over 60, it can be silently dangerous in ways that most people never suspect. Let me tell you about Robert, 74 years old, veteran from Florida. Proud man. Slept like a soldier his whole life, flat on his back, arms by his side. But his wife started noticing something terrifying. Long pauses in his breathing at night. Sometimes 10 seconds, sometimes 30. Then a loud gasp as his body jolted awake for air. This happened dozens of times every night, and Robert had no memory of it in the morning. He just knew he felt exhausted. When Robert finally saw a sleep specialist, the diagnosis was severe obstructive sleep apnea. His sleeping position was allowing his tongue and the soft tissues at the back of his throat to fall backward under gravity, blocking his airway up to 30 times per hour. Each time his oxygen dropped, his brain fired an emergency response. Adrenaline surged, blood pressure spiked, his heart jolted. Then it happened again, and again, and again, for 8 hours straight. According to the American Academy of Sleep Medicine, untreated sleep apnea in adults over 60 increases the risk of stroke by 3 times, and the risk of heart attack by 2.5 times. It raises nighttime blood pressure, damages brain cells through repeated oxygen deprivation, and is directly linked to atrial fibrillation, the irregular heartbeat that is one of the leading causes of stroke in seniors. It also accelerates cognitive decline. Studies show that untreated sleep apnea can age the brain by up to 10 years. Lying flat also worsens acid reflux, a condition affecting nearly half of adults over 65. When your head is level with your stomach, gravity cannot keep digestive acid where it belongs. It creeps upward into the throat, burning the esophagus and interrupting sleep. Over time, it can damage the vocal cords and lungs, what doctors call silent reflux. Robert's years of flat sleeping had already taken their toll. Constant fatigue, forgetfulness, and blood pressure that refused to drop despite 3 different medications. His story reminds us that sometimes stillness hides danger. The fourth dangerous position is one that millions of seniors have adopted out of necessity: sleeping in a recliner every night. It starts innocently. The recliner feels easier on aching joints than a flat bed. But sleeping semi-upright in a chair every night restricts blood flow to your legs. Your body stays in a position where the veins in your legs cannot efficiently return blood to the heart. The result is fluid retention, swollen ankles, and in severe cases, deep vein thrombosis. Those are blood clots that can break free, travel through your bloodstream, and lodge in your lungs. That condition is called a pulmonary embolism, and it kills more people each year than breast cancer and car accidents combined. Let me tell you about Dorothy, 79 years old, from Arizona. After years of chronic hip pain, she found she could finally sleep through the night in her recliner. But over months, her legs started swelling. Her energy faded. Her doctor warned her that prolonged recliner sleeping was preventing her body from ever reaching deep sleep, the restorative stage where your brain consolidates memories, your muscles repair, and your immune system rebuilds. Dorothy was sleeping 8 hours, but her body was getting the equivalent of 4. She told me, "I thought I was resting, but I was slowly shutting down." Now, which of these 4 positions do you recognize in yourself? Be honest. Drop it in the comments below. I have a strong feeling at least 1 or 2 of these hit close to home. Let me show you what to do instead. 4 positions that can protect your heart, open your airways, and help your body actually heal while you sleep. Position 1. The supported side sleep with a pillow between your knees. This is what most sleep specialists now consider the gold standard for seniors. Sleeping on your side, preferably your left side, with a soft pillow gently placed between your knees. Here is why the left side matters. Your heart sits slightly to the left in your chest. When you sleep on your left side, gravity helps blood flow return to the heart more efficiently. It also keeps the stomach below the esophagus, dramatically reducing acid reflux. The pillow between your knees keeps your pelvis balanced, relieving pressure on your lower spine and hips. Research from the Cleveland Clinic confirms that this position promotes better cardiac function, reduces snoring, and keeps airways open. Let me tell you about Alan, 71, retired firefighter from North Carolina. For years, he woke up every morning with a dull ache in his lower back and hips. Pain pills helped a little, but the stiffness always came back. His physical therapist suggested one change: a pillow between his knees. Within 2 weeks, his pain decreased by nearly half. He said, "It is like my body finally exhaled." Position 2. The elevated back sleeper. Head and knees slightly raised, about 30 degrees. You can use a wedge pillow or an adjustable bed frame. This keeps stomach acid down, airways open, and reduces snoring and sleep apnea episodes dramatically. The slight elevation means gravity keeps your tongue and soft tissues from falling backward. Your oxygen levels stay stable all night. Your heart does not have to work overtime. One of my patients, Linda, 73, had struggled with acid reflux and shortness of breath at night for years. She often woke up coughing, her throat burning. When we elevated her upper body